We're going to talk today about bone, and before we start on kind of a review sheet of introductory parts of the book and actually of bone, let's just take a look at what I would consider a typical long bone. And if we can understand this very simple concept, it'll make all the questions that we're going to go through very easy to understand. If I was to look at a long bone, I always kind of think that of a diagram that you would see of kind of like a dog bone. It's called long because it is long. It's longer than it's wide. And when I look at a bone, I know that there's an end of a bone called the epiphysis. I know that there's a shaft of a bone called the diaphysis. I know that there's a region on either end of a long bone that disappears with age, but that's called the growth plate. There's an area in this region between the epiphysis and the diaphysis that's a term that's not used as much as it used to be, called the metaphysis. Inside of the shaft of the long bone is something called a marrow cavity. That marrow cavity is going to have a lining called an endosteum. The diaphysis or shaft is going to have a covering called a periosteum. Inside of that marrow cavity is going to be marrow, but it's actually going to be yellow marrow or fat. As we move towards the epiphysis or end of the bones, I'm going to find some bone that's really comprised called spongy bone. And it's in that spongy bone that I'm going to find my tubules called trabeculae. And inside of those trabeculae or tubules, I'm going to find red marrow. So kind of think of the majority of the bone is going to be compact bone. So this region here would mainly be compact bone. And then we'd have some spongy bone in this region. And then we'd be surrounded again by some more compact bone. And then significant is what's going to cover this epiphysis. And that covering of the epiphysis is going to be cartilage, and that's why we're going to call it hyaline, which means shiny, articular, which means a joint, cartilage. So kind of think that's what's really significant of the big picture. The second thing before I move on to these questions, I want you to understand that when we look at compact bone under a microscope, we see something called an osteon. And an osteon is considered the functional unit of compact bone. And so if I took a piece of compact bone and looked under a microscope, I'd see these concentric ring circles. And we'd have to name for what those are. So each one of these concentric circles would be an osteon. And inside of those osteon, I'm going to find concentric rings. And you can see these concentric rings that are making up the rings, kind of very similar to the rings of a tree, called lamellae. And then I'm going to have some open spaces called lacunae. And since bone is a living structure, it's got to have a blood supply. So these are called Haversian canals. And then I've got to interconnect Haversian canals with little canals called canaliculi. So again, just trying to understand the big picture, microscopically what a bone looks like, and then what a bone looks like macroscopically if we were just looking at a bone itself. So now what we're going to do is take a look at some questions that really do a complete overview of things that are significant in what I would call the introduction and bone material for anatomy and physiology. So the first question says the anterior pectoral girdle bone. Well, if you kind of think that the pectoral girdle is comprised of the clavicle and the scapula, and since the front of my body is the anterior, the bone that runs across my shoulder here is actually going to be my clavicle. So the anterior pectoral girdle bone is the clavicle. Okay? That's a bone that's very easily broken. You're always going to see kids that are either going to be playing soccer or someone's going to fall. And it's a very, what I would call, flimsy bone, and it breaks fairly quickly. And it's the one that's significant is actually allows for childbirth. So kind of think when the body's got to come through the birth canal, I've got to draw my shoulders together. And as I draw my shoulders together, I've got to have this clavicle fairly flexible so I can make my body somewhat narrower for passage through the birth canal. So that's why I say always think of significance of something, or why do I need to know that. Question number 2 says the posterior leg bone. Remember, posterior is the back of the body. So therefore, the posterior leg bone is going to be the fibula. The significance of the fibula, again, saying why should I know about it, is it's oftentimes the result of a skiing injury, and the reason being is it can actually break almost like a green stick fracture. So kind of think that when someone takes a stick and breaks it, and it kind of splinters, that's what you're going to see with the fibula. Number 3 says lines or covers. Well, to line or cover is defining something called an epithelium. Now, if something is called an epithelium, for example, an epithelium equals an epithelium everywhere except in blood vessels and lymphatic vessels. Because in blood vessels and in lymphatic vessels, we're going to call an epithelium an endothelium. So just remember, an endothelium is an epithelium inside of a blood vessel or a lymphatic vessel. Number 4 says lines, it says diffusion of water through a semi-permeable membrane. Well, that's a very simple answer called osmosis. So nothing tricky about that. It's a very commonly asked question in board exams or even entrance exams. Number 5. 5 says cell water. We've all seen a cell. We know that when we look at a cell, we can say that it's got a nucleus. And it's probably going to show some organelles, so I'm just going to put a couple organelles in here. Like this one might be called a mitochondria. Or I could see something like this would be called some endoplasmic reticulum. But the significance here is these organelles, so that's what all of these are organelles or little organs. And they have to be sitting inside of something, so therefore what they're sitting inside of is the cell water. Of course, that cell water is going to be the cytoplasm. Number 6 says the muscle that separates the abdomen from the thorax. So now if we take and say a very simple drawing, that if this would be the abdomen up here, and this line that's separating here would be the abdomen. I'm sorry, this is the thorax, and this is your abdomen. And this would be the pelvic region. This muscle that separates my thorax from the abdomen, or sometimes called the abdominal pelvic region, that's going to be my diaphragm. And we'll also learn the significance of the diaphragm is it's going to equal the principal muscle of respiration. Number 7 says contains the heart, great vessels in the esophagus. Well, again, making a very simple diagram is that if this is going to be my thorax, and this is going to be my diaphragm, and here sitting are my lungs, and between my lungs, because each lung is going to sit in its own cavity, so you could say that this would be, the entire thing would be the thorax. This would be my pleural cavity. And sitting in between is going to be that region called the mediastinum. So when it says contains the heart, great vessels, and esophagus, that's my mediastinum. I probably could add a significant also piece to that, because besides that, it's going to also contain some nodes, some lymph nodes. And again, answering why it's significant to know that, because I've got my heart and I've got my great vessels and I've got these lymph nodes sitting inside of this region here, you may look at a chest film someday and say, you know, somebody told me the heart is always shifted to the left. And then when you look at the chest film, you're going to notice that the heart is shifting over to the right. And now the question is, why am I seeing it shifted over to the right? And the answer might be because I've got enlarged lymph nodes or a tumor inside of the mediastinum, possibly from smoking, that's shifting my heart over to the right side instead of being shifted over to the left side. So again, it always answers the question is, why do I need to know something? Number 8 says the connective tissue without a blood supply. And of course, connective tissue without a blood supply says we need to just compare bone to cartilage. Well, both bone and cartilage come from a germ layer called mesoderm. So that means they're alike in that term. But the difference is bone is vascular and cartilage is avascular. So it really has no blood supply. So when you take a non-steroidal anti-inflammatory medication like a Motrin, ibuprofen, aspirin, you're thinking, gee, when I'm taking that medication, it's actually passing through my bloodstream and actually taking the inflammation away. But in effect, all it's really doing is working at the fluid that's surrounding the cartilage. So there is no way to get blood inside of cartilage. If you had an infection of cartilage, the issue becomes trying to control that infection. And therefore you'd have to do probably an incision and drainage, and with lavage, either inject antibiotics directly into the fluid, but there's no way to get something into the cartilage. So that's why when people say, gee, they've got arthritis and they're taking oral chondroitin supplements, the answer is there's no way that chondroitin could build new cartilage, because when I swallow any of those medications, they have no way of possibly getting inside of the cartilage. Number 9 says the bony matrix. Bony matrix is actually going to be a term called hydroxyapatite. And hydroxyapatite is comprised of calcium plus phosphate. So that's why when people have low bone density, the significance is make sure you're taking enough supplements of calcium and phosphate. And of course, when you take calcium, the problem is getting the calcium to stay within the body and basically not to urinate all of it out. So that's why so many people have D3 deficiency. So therefore, you also, when you take calcium, you've got to get something to absorb the calcium. And so I might take 33,000 milligrams of calcium every day, but unless I take some cholecalciferol, which would be vitamin D3, I actually would not be increasing the amount of calcium in my bones. Number 10 is joins the pelvis anteriorly. Well, if you think of the pelvic girdle, as the pelvic girdle comes around the front of the body, it's actually going to be joined by a fibrocartilage disc. And that fibrocartilage disc is called the pubic symphysis. And of course, the pubic symphysis function is going to be for childbirth. So that's the significance of it. And it's also going to be slightly movable. So as you learn about terminology, because the pubic symphysis has a little bit of movement in it, we're going to say that it's a amphiarthrotic joint. Slightly movable. 11 says the cup for the femoral head. Well, the femoral head, if you kind of think of the femur, is a little bit like this, and it comes up. and then you've got your trochanters, and this head of the femur has got to sit inside of this cup. And if you looked at it another way, it's really just looking at some other way of doing it. Would be looking at a lateral view, and if I looked at a lateral view and said that this was the ilium and this was the ischium and this is the pubis, and again, there's the pubic symphysis we just talked about. So this structure right here is actually going to be the acetabulum. So the acetabulum gets its name from the little cup of acid. You'll have patients come in and say, you know, my hips feel like someone just poured acid into my bone. And actually they got that name from the Latin derivative of bulum, cup of, aceta, acetic acid. And remember that acetabulum is going to be comprised of 3 bones. It's going to be comprised of the ilium, the ischium, and the pubis, all 3 bones. So if someone asked you in a test that, or someone told you as a patient that they broke their femur and their acetabulum, how many bones did they break? The answer is they broke potentially 4 bones. They broke the femur, and then they broke the acetabulum, comprised of 1 ilium, 1 ischium, and 1 pubis. Number 12. 12 says ducted glands. Well, a ducted glands means that it has to empty into a tube-like structure. It is not going directly into the bloodstream. So a ducted gland would be called an exocrine gland. When you study the endocrinology and you study the glandular system and the different types of glands, how they secrete, we'll learn about how there's exocrine and endocrine glands. So remember, exocrine is going to secrete directly into a tube, into a region. So when you think of a great example would be like a sweat gland is an example of that, or an oil gland. Any of those type of glands are exocrine. Number 13 is a belt line cut. Again, when we were studying histology and we spent a lot of time with it, we would always look at a belt line cut or a horizontal, it's called, a horizontal cut. So if you said to me, you know, we're looking at we'll just use a very simple example, is that we had a cadaver. And on that cadaver, we wanted to do a cut either vertically or horizontal. So if we cut straight across here, for example, if we move the calvaria from the cranial vault, so like for example on this, if I was to say this was my cranial vault, and here it is like this, and I took and here's the calvaria or the skull cap, and I said what would a horizontal cut be or a horizontal plane, it would literally be taking that skull cap and running directly across here where I see this line. So that would be what I would call a horizontal cut. Whereas if I was saying, you know, a vertical cut or a midline plane, that would be just coming right straightly down the middle of the face here. Okay? So kind of think of those are terms that we would use in histology. Number 14 says the master gland. Well, since we've already said there's something called endocrine glands and exocrine glands, number 14 is going to be the master gland, which is the pituitary gland. Remember, the pituitary gland is going to have an anterior pituitary, and it's going to have a posterior pituitary. It's that anterior pituitary that's called the adeno for glandular hypophysis. And the posterior is going to be the neuro hypophysis. Number 15. 15 says the skin system. Remember, the skin system is called the integument, so therefore that's the integumentary. I think when you're thinking about skin, a significant thing to remember is the layers of the epidermis. So if I said, what are the layers of the epidermis? You're going to remember an acronym that Californians like: girls in string bikinis. And you can use any one you want, but if you think of this, Californians like girls string bikinis, that's going to tell you that they're layers. So therefore each one's going to be called a layer, called a stratum. And C is going to stand for corneum. L is going to stand for clear or lucidum. G is to stand for granular or granulosum. S is going to stand for spicules or spines or spinosum. And B is going to stand for basal or basal layer. And it's that basal layer of the epidermis where we're going to learn about something called basal cell carcinoma. And just think that basal cell carcinoma is the most common cancer in the world. It's the cancer that probably 90% of people have by the age of 30. So again, answering the question, why should I know something? 16 has always been a point of dispute as to what the largest organ is. Since I'm looking at skin as being a system, I'm going to stick with the old way, and the best answer being the liver. So just remember, the liver is going to be the largest organ, and always in a test, always remember, if you don't know the answer, I always say the liver has got 1,001 uses. So kind of think of, it's very similar to the old example of what superglue is used for. Number 17. 17 says front of the body. That's either going to be anterior, or another name could be ventral, or sometimes we'll just say the front of the body. Number 18 says the, I think I missed one over, so this is 18, excuse me. This is going to be 17. 17 says the, yeah, that's right, I missed one here. I missed the 3 germ layers. So the 3 germ layers, let me just back up there. So that's correct for 16. This is 18. 17 is 3 germ layers. We're going to, what I'd say, teach embryology in about 1 minute here. And basically we're going to say there's going to be ectoderm, endoderm, and mesoderm. Ectoderm is going to be epidermis, just like I talked about the 5 layers up above. It's going to be the lens. It's also going to be the nervous system. When I think endoderm, I'm going to think guts, glands, or viscera. When I think mesoderm, I'm going to think bone, blood, cartilage, all connective tissue, and therefore that's going to be the 3 layers. So when you think of what the significance of that is that all the organs of the body are going to have to be comprised of 1 or more of these 3 germ layers. And that's significant in cancer, because if we have a crossover from a germ layer to another one, that's when something becomes significant. For example, if you said you started out with something that was right here, it said it was it was in the gut. So for example, if I had a tumor inside of my distal colon, well, that would be an endodermal tumor. But if I didn't take care of it or excise it or laser it away quickly, that tumor would spread to the muscle layer, and of course muscle is actually going to be in mesoderm. So now because I've crossed the germ layer, and since mesoderm also contains blood, that tumor that originally was in the endoderm or the guts now has spread to muscle, and because it's in the muscle, it's also in the blood, and now it's going to metastasize to other parts of the body. Number 19 says the first cervical vertebra. First cervical vertebra is called the atlas. Atlas sits really connecting to what are called the occipital condyles. 20 says resting mitosis phase. That's going to be interphase. Remember, interphase is going to be the longest phased. Again, significance of interphase is that it's where I'd want chemotherapy to work. I would want to take a cell and keep it in the resting phase so that it would stop cell division. That answers the question that basically why when someone gets cancer and they get chemotherapy, they lose their hair from it or they get stomatitis, and the reason being those are the fastest growing cells in the body, just like cancer cells are. Contains CHO, that's a carbohydrate. (22) contains CHON, that's a what? Well, we know that amino acids are the building blocks of protein. So if I take a carbohydrate, add an amino acid group or a nitrogen group, so therefore that's CHON, and CHON is a protein. 23 says the symbol for selenium. Selenium is a trace element, so therefore that's Se. 24, skull cap, that's the calvaria. You want to remember that the calvaria is actually made out of bones and sutures. You're going to have 6 bones, and you're going to have 5 sutures. Number 25. 25 says number of bones in the skull cap. Well, we just answered that. 6 bones. Number 26, number of sutures, and says their names. Okay? So to do that, we can do it very quickly by just looking at a calvaria. So here's your calvaria. If you notice, I've got a bone up here. I've got 2 bones here. I've got a bone on either side. And then I've got a bone at the back, right across here. And I'm seeing these lines that are separating these bones. So if I draw that very simply and say what are the bones and what are the sutures, if this is going to be the front and this is the back, this is anterior and this is posterior, I'm going to run a suture down the middle, another suture on the side. I'm going to name these bones. That's your frontal. That's your occipital. That's your temporal. That's also your temporal. And these are your 2 parietals. So therefore 1, 2, 3, 4, 5, 6 bones. Then I'm going to have sutures. Remember, a suture is going to be an immovable joint. an immovable joint is called a synchondrosis. Let me take a second here. Can we take a break? I just want to get a drink.
Yeah, go ahead and take it.
Okay, back up. Can we just back up to where I was? Because I said something I didn't want to say. So,
Yeah, you can start on the wherever.
okay, so a suture is an immovable joint, which is synarthrotic. So it cannot move. And that's why when they look like a suture, because they almost look like a stitch. And inside of each of those stitches are going to be little tiny bones called Wormian bones. And now we just have to name the sutures. So we've got a suture on the side here, and that's called the squamosal. And I've got another one on this side called the squamosal. I've got one on the back called the lambdoidal. I've got one on the front called the frontal or coronal. And then I've got one down the middle called the sagittal. So therefore, if we think of what are the names of the sutures, well, I've got one frontal, number 2 would be lambdoidal, 3 and 4 would be my temporals, and then 5 would be my sagittal. So that tells me that the calvaria skull cap has got 6 bones and 5 sutures. Number 27. 27 says, what's the powerhouse of the cell? It's actually called an organelle called a mitochondria. A mitochondria is responsible for cellular respiration. Cellular respiration is actually going to be the taking of sugar, so CHO, glucose, in the presence of oxygen is going to produce 38 ATP, which is called my energy currency. And so now if we just break that down a little bit, if we've got 38 ATP, 2 of those ATP are going to come from anaerobic respiration. 36 of those ATP are going to be from aerobic. And therefore together they add up with 38. Hence that tells you the significance of you want to be as aerobic as possible, because when you undergo anaerobic respiration, you're going to build up lactic acid. So it's this anaerobic respiration that's going to cause lactic acid. That's why when you don't exercise often and all of a sudden go to the gym and run 6 miles, the next day you have pain in your joints, and that's from the buildup of lactic acid, which could lead to a metabolic acidosis, which would be a change in the pH of your blood. Number 28. 28 says the folds in the powerhouse of the cell. If you look at a mitochondria, you'll see that it's got this folded inner membrane, and those are called a cristae. Sitting on those cristae are going to be my respiratory enzymes. And the significance why I want to know those is because when you fold something, you increase the surface area. So you can imagine just folding a sheet of paper that was 8.5 by 11. If you folded it in 8 separate times, instead of having, 8 times 11 or 88 square inches, you could probably have 10 times that, or 880 square inches. So that's the significance of these foldings inside of a cristae for respiratory enzymes. 29 says the energy currency. And we, of course, know that's ATP, and ATP is adenosine triphosphate. Number 30 says soft spots. Everyone's heard of soft spots because someone said, be careful to drop the infant on its head, and therefore that's called the fontanelles. I've seen fontanelles spelled a couple different ways, so sometimes you'll see it as Fontanelles. So there's different spellings for it, but just think those are where the soft spot of the infant's head. 31, abnormal lumbar curvature. Just think L stands for lordosis. 32 says abnormal thoracic curvature. That's going to be the word kyphosis. Kyphosis you're oftentimes going to associate with the word hunchback. As far as patients or pathology, you're going to often see kyphosis in a female's with broken vertebrae. Basically, the problem is that they've had such low bone density or osteopenia porosis for so long that the bodies of their vertebrae break, and they develop a hump really towards the back of their neck, and they literally can only see you when they're sitting down. When they stand up, they're basically looking at their shoes. So that's something that leads to, in a female, and again I'm using the female symbol here, something called a dowager's hump. Number 33 says an S-shaped curvature. That's going to be a scoliosis. I think the significance of those as far as radiography is concerned, if you wanted to take an x-ray of someone that had lordosis, well, just kind of think that lordosis means that the vertebral column at the lumbar region, so if this was the straight vertebral column and I had lordosis, I would kind of see a bend that looks like this. But if I would have to, in order to see that bend, I would literally have to take a picture from a lateral view in order to see that bend. So I'd have to have a lateral view of it. Same with the kyphosis, because that kyphosis is going to be further up in the thoracic region. But a scoliosis, because it's S standing for S-shaped, in order to diagnose a scoliosis, I'd want to see an anterior-posterior view, because the vertebral column would be exaggerated like this. So remember, the difference is to view a lordosis or kyphosis is a lateral view. To view a scoliosis is going to be an AP or anterior view. 34, number of cranial nerves. That's going to be 12 pair. I was talking about spinal nerves there. So 34 is 12 pair. Remember, 12 pair is 24. And of course, those are going to emanate out of the intervertebral foramen.